All right. We want to get now to the facts of the science of what the president is flouting in every move lately. Joining us now, infectious diseases physician and medical director of special pathogens unit at the Boston University School of Medicine, Dr. Nahid Bhadillia. She's an NBC News and MSNBC medical contributor. And thanks for waiting. We sort of wanted to put this all into context. We still have the headline of the undercount of coronavirus cases. We have a number of states pausing their reopening because the numbers are going up. We have President Trump pulling federal funding for testing. We have President Trump moving to invalidate health care for millions of Americans. And Dr. Bhadillia, he tweeted last night, coronavirus deaths are way down. Mortality rate is one of the lowest in the world. Our economy is roaring back and will not be shut down. Embers or flare-ups will be put out as necessary. Do you see this virus at the rate it's going as flare-ups and embers? Or how would you describe where we stand with the coronavirus?
Mika, it's been said multiple times, but I don't even think we've left the first wave, right? And we are hitting not like records every single day. We're passing records of the highest number of cases that we've had. And what the president's sort of missing out when he talks about the fact that mortality is low is that first you get cases. A percentage of those cases then get hospitalized. So hospitalizations are lagging indicators. And then the last indicator, the one that lags the most, is unfortunately deaths. And so the rise in infections that you're seeing now, you will see people then, unfortunately, a portion of those people get sick enough that will pass away. And we will expect to see a death rate then go up because of that. Now, everybody's hope is that mortality rate or death rate is going to be lower than what we saw during April and May, is because, we know more about this disease. We have some tools to deal with it. But the thing that's working against it is the fact that now this pandemic is playing out in states that potentially don't have the same kind of resilience in their healthcare systems. Texas, you talked about Texas, Carolinas, Florida. Those are states that even before the ACA, even before the pandemic, had high amounts of patients who are uninsured. These are states that have very low level of public health spending. And on top of that, if you're taking away the safety net for people to be insured to be able to seek that type of care, you're basically driving into a situation that might increase income inequality in this country, because people who need the health insurance are people who are frontline, essential workers, highest risk of getting this disease. Those are also the folks that are most likely to, unfortunately, get the disease and may need hospitalizations, and then would have the cost of those hospitalizations affect them really pretty severely economically as well.
So let's look at this as well. According to Johns Hopkins University, out of the 20 countries most affected by COVID-19, the U.S. has the 7th highest observed case fatality ratio for COVID-19 and 3rd highest per capita death rate. New modeling predicts the virus will kill 180,000 Americans.
Again, the 3rd highest per capita death rate in the world.
Yeah, thank you. And new modeling predicts the virus will kill 180,000 Americans by October. What would be the steps that could be taken to try and stem those numbers, to bring them down?
One of the biggest things that we've seen is that we've lost a portion of Americans in this fight, because we haven't had a national vision or strategy for this pandemic. Part of it is because science has changed, and because of that, public health policies had to change, and we haven't had a national public health presence, continuously to sort of explain those changes. And the third is that there are portions of our politics or politicians that have politicized interventions to this pandemic, which has driven people away from the very steps that they need to take. And so we need to basically take this to the local level. We have to take to cities. You might have seen this town hall that happened in Florida that was televised, where there was this immense amount of anger that was poured out for mask
Yes.
mandates that are so necessary. And that, to me, that reminds me, in 2014, one of the deployments that I had in West Africa, I was in an Ebola treatment unit, and outside the Ebola treatment unit, there were people who were angry with machetes because they were afraid that we were potentially doing something to their families. It's the same feeling. It's this fear. It's this anger of the unknown. And we haven't had a unified public health voice to give that to the American people. So this drive, in my mind, now needs to go to the local level. We need to win over community stakeholders, churches, local politicians, people that can then help us get the message across. So that's one of the biggest things that I see that's missing right now.
Dr. Nahid Bhadelia, thank you so much for being on this morning. And still ahead on Morning Joe, the other part of the 1-2 punch of the pandemic. We've talked about the health impact, and up next, we'll dig into the economic challenges facing the country. You're watching Morning Joe. We'll be right back.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.